I guess we want to look forward. Let's talk about the 2026 election. We had Julie Kay in here talking about redistricting and sort of leading up to the 2026 election. Now, one of the races that we have our eye on is the congressional race, District 11. So District 11, think of Buncombe County, Asheville, and surrounding counties there in Western North Carolina. And one of the men who decided to toss his hat in the ring is Dr. Richard Hudspeth, Democrat there from Western North Carolina, former CEO of Blue Ridge Health, family physician, recently announced his run for Congress. Dr. Hudspeth, thank you for your time.
Thank you. A pleasure to be here.
Let's get to it. You're there in that area. Why did you decide to throw your hat in the ring and run for Congress?
I've been a family physician here my whole life, but in Western North Carolina for over 20 years. And I've been, as you mentioned, the CEO of a community health center, Western North Carolina's largest community health center. Really spent my career advocating for affordable health care for everyone, because I believe that no matter your income level, everyone deserves access to affordable health care. And I've spent my life providing that. And yet, in the past 10 months, we've really seen a disastrous destruction of whatever healthcare infrastructure we had. We've seen really draconian cuts to healthcare research and the erosion of trust in medical and science information. And I have this really deep desire and obligation to actually continue to fight for health care for people in Western North Carolina. I've expanded access, really quadrupled the amount of providers and access and patients for people in my time here in Western North Carolina, and I don't want to stop there. I want to move forward and not backwards, and that's why I'm jumping into this race.
Let's stay there with healthcare, because there's a poll up on NBC News from the New West Health Gallup survey, and it finds that more Americans are anxious when it comes to healthcare in 2026. We all know what sort of played out with the government shutdown, Obamacare, subsidies. There are lawmakers in the White House still trying to figure that out. We heard from Senator Chuck Schumer earlier on his healthcare plan. Your assessment of that and its impact on Western North Carolina?
So the impact will be great, and we are feeling it already. And people actually, I'm not being over dramatic, they need to be concerned about their health care. The Affordable Care Act subsidies are just really the tip of the iceberg. And when you think about an iceberg, there's a whole lot more damage underneath that we haven't necessarily felt or experienced, but we'll see in the future. We've already seen in Western North Carolina cuts to Medicaid, specifically within the state of North Carolina, that's going to really potentially limit the number of patients who have access to healthcare providers who may drop out of the Medicaid system altogether. We're going to potentially see cuts further on to Medicaid expansion. As you know, North Carolina only expanded in December of 2023. They were giving themselves 3 years to get up to their goal of about 600,000 people. In a year and a half, there are 650,000 people on Medicaid expansion now having access to healthcare. That is at risk. It is particularly hard hit in rural areas. What we will see, likely, more cuts in services, more cuts to nursing aspects in our rural hospitals, where you're going to see threats to the care that your loved ones get when they're sick in the hospital. We will likely see closures to some of our rural hospitals. If you remember, Tom Tillis, when he decided or was forced to kind of back out of the race, he said, I can't vote for this bill because it is going to hit rural North Carolina hardest, and I can't vote for it. And so he was right in that regard. It is a very dangerous prospect of what we see in the future of rural healthcare. Again, and one of the reasons that I'm getting into this race.
And I do want to point out, North Carolina did apply for the $200 million $200 million from the Rural Health Transformation Program, which is authorized by the One Big Beautiful Bill. For those who don't know, there are a lot of folks that moved to the Charlotte area, moved to North Carolina, and a lot of folks don't really get a chance to wrap their arms around how rural North Carolina is. I mean, you talk about southeastern part of the state, Robinson County, out west, northeastern North Carolina. how would you describe, and you touched on it, the state of rural hospitals in those parts of the state?
Yes. So first I want to mention, yes, North Carolina did apply for $200 million, but what I call the big barbaric bill that was passed, it cut $50 billion from healthcare in North Carolina. So $200 million for this potential innovation grant is a drop in the bucket compared to the cuts that rural hospitals in North Carolina will see. When our rural hospitals, really in our rural areas of the state, whether it's out east or here in the west, those hospitals are probably 70% Medicaid and Medicare. And they're already operating on super slim margins. When you cut those margins, that means loss of nursing care, loss of services, or closures of those hospitals. So those are very real. There are a number of hospitals and communities already, as I'm out moving my campaign forward, we're already seeing those communities are concerned about whether their hospitals will actually survive what's happening in Washington, D.C. right now.
Sticking with Western North Carolina, obviously, because that's where you are, that's your community. Is the federal government doing enough when it comes to the Helene recovery process? We're more than a year out from Helene, just devastating that area. Is the federal government doing enough?
Absolutely not. Our current representative has a seat on the powerful Appropriations Committee, saying that he was going to help us with Helene recovery, and we haven't seen that happen. We're probably at about 10% in comparison of the 10% of the amount of damage that's been done, where other large natural disasters, hurricane natural disasters, those communities have seen on average about 60 to 70% of influx of dollars into their community. Josh Stein, our governor, came out and said, you know, Western North Carolina is sitting at about 9%. We're probably maybe about 10% now. It was a $60 billion hit to our economy, to our community, to our infrastructure that we are going to struggle to rebuild without federal dollars and federal assistance to that. So just today in our local paper here, one of our local papers talked about that Buncombe County, and there were 5 other counties that are now considered distressed counties economically this year from the state of North Carolina. So we are far from recovered. We continue to need assistance, and we believe that the federal government is failing us in our ability to create a robust rebuilding of our infrastructure, supporting small businesses, supporting housing initiatives to get people back here after Helene in order to support our economy and grow our business.
And one of your platforms, as you mentioned, affordability, healthcare, but also that extends to, as you mentioned, housing, groceries, everyday items. What are the conversations that you're having with folks in your community about being able to afford things, especially coming off of a government shutdown, the uncertainty with SNAP benefits? What are those conversations like?
As you can imagine, those conversations, people are nervous and they're scared. You mentioned SNAP benefits. That was really troublesome to people, and we saw just within the few days that we had issues around that, people really suffering within their inability to get food that they had really relied on. We saw some of those same cuts really in North Carolina. They had what was called a Healthy Opportunity Pilot that covered lots of North Carolina, and the state legislature decided not to refund that. That was the same principle around these SNAP benefits, providing people with, evidence-based but non-medical assistance, whether it's for food, whether it's for housing, et cetera. I think we know in our communities here in Western North Carolina, as well as I'm sure Charlotte and other places in North Carolina, that housing is a tremendous problem. We see that all along. But all of this affordability ties in together, right? Well, I can't afford my health care, especially when they cut those health care credits and the subsidies, because my rent is so high, because my electric bill is so high, because my auto insurance is so high, my gas is so high, my groceries are so high. All of these things are connected, and we can begin to chip away at what that affordability looks like. Perhaps rethink these tariffs. Get healthcare to a place that makes it more affordable so people can do that. Build more housing in order to help us create, more supply so the demand drives that, so that increase in supply will drive the price of housing down. All of those things are possible. I take the community health center model. The government, yes, gives community health centers some seed money, but we run with that. We hadn't had an increase in our federal community health center grants for over 6 years when I was a CEO there for 10 years, yet we quadrupled our business. That's a great return on investment. And I think if the federal government can drive some of those innovation models that we had in community health around housing and around other important things, childcare, we can really move this country forward in ways that we're not seeing happen right now.
Dr. Hudspeth, you've been so generous with your time. Before I let you go, the 11th Congressional District has been a Republican stronghold for quite some time. Chuck Edwards now holds that seat. When did you make that decision to run, and when was the moment? And was there a moment that you knew this was the right time to run?
So I actually ended up filing with the FEC back in the middle of September or so. So that's really when I got into the race. I think I had been contemplating this and talking to a lot of folks across North Carolina and other politicians, et cetera, to decide whether this was really a possibility. And so that's there wasn't a moment other than when I saw what was happening at the turn of our administration in January and February, March and April, all of these things happening. I felt like it was super important to get into this race. I want to make sure your folks, know that I'm out there on richardhudspethforcongress.com. Please check my website to see what my platform looks like and all of the great things that we're doing around this campaign in order to do it. Yes, it's probably the Cook report has dropped this to, a little bit less Republican than it has been. We know the largest voting bloc in Western North Carolina are unaffiliated, so we need to hit those folks hard. We know the Democrats are going to come out, and we need to make sure that we're connecting with the unaffiliated voters as well in order to accomplish our task.
I do have one follow-up to that. What does the messaging look like going into 2026 versus in 2024? And I want to clarify that as far as Democrats.
I think the messaging really is, again, kitchen table issues, healthcare costs, childcare costs, grocery costs, lack of affordable housing. None of these things that the current administration that they ran on in 2024 has actually had any improvement since they took office. And from my perspective, what I see is worse. Less access to health care, housing around Western North Carolina costs more than ever. We haven't seen any change in that other than going up. So these are the things that I think we need to run on. Certainly number one issue is health care. When Roy Cooper announced for his U.S. Senate seat, he said his number one issue is health care. He's our health care governor, and I think partnering with him in order to make sure that we get a advocate for healthcare in the Senate and an advocate for healthcare in Congress would be fantastic.
Dr. Hudspeth, again, thank you for your time. Look forward to speaking with you soon here on Live Impact News on WCNC Plus. Yes, we'll talk soon. And again, thank you for your time. Have a great day.